Throughout human history, infectious diseases have shaped civilizations and altered the course of nations. The Plague of Justinian arrived in the Byzantine Empire in 541 CE, entering through Egyptian grain ships that docked in Constantinople. The bacterium Yersinia pestis, carried by fleas living on black rats, spread rapidly through the densely populated capital. Contemporary accounts from Procopius describe bodies piling up in the streets as the disease killed an estimated 5,000 people daily at its peak. The plague persisted in waves for approximately 2 centuries, claiming between 25 and 50 million lives across the Mediterranean basin and Europe. Agricultural production collapsed as rural populations were decimated, and the Byzantine military lost substantial numbers of soldiers, weakening the empire's ability to defend its borders against Persian and later Arab invasions. The Black Death emerged in Central Asia during the 1330s, traveling westward along the Silk Road trade routes. Mongol armies besieging the Genoese trading post of Kaffa in Crimea in 1347 catapulted plague-infected corpses over the city walls. Fleeing merchants carried the disease aboard ships to Mediterranean ports. The plague reached Sicily in October 1347, then spread to mainland Italy, France, and Spain. By 1348, it had crossed the English Channel and moved through the British Isles. The pandemic advanced northward and eastward, reaching Scandinavia and Russia by 1350. Between 1347 and 1353, the Black Death killed an estimated 75 to 200 million people, reducing the global population by approximately 30 to 60%. In some European cities, mortality rates exceeded 70%. Entire villages were abandoned, labor shortages transformed economic systems, and the feudal structure began to erode as surviving peasants demanded higher wages and better conditions. Smallpox existed in human populations for thousands of years, but its introduction to the Americas created catastrophic demographic collapse. When Spanish conquistadors arrived in the Caribbean in 1492, the indigenous populations had no prior exposure to the variola virus. The disease reached the Aztec Empire in 1520, killing the Emperor Cuitlahuac and millions of others. Historical records suggest the population of central Mexico declined from approximately 30 million before contact to 3 million by 1568. Smallpox spread to the Inca Empire in the 1520s before Francisco Pizarro's arrival, killing the Emperor Huayna Capac and precipitating a civil war that weakened resistance to Spanish conquest. Across the Americas, smallpox contributed to population losses estimated between 90 and 95% of indigenous peoples over the following century. The disease continued to kill 400,000 Europeans annually through the 18th century, until Edward Jenner developed the first successful vaccine in 1796. Cholera emerged from the Ganges Delta in India in 1817, beginning the first of 7 major pandemics. The bacterium Vibrio cholerae spread through contaminated water supplies, causing severe diarrhea and dehydration that could kill within hours. The first pandemic reached Southeast Asia, the Middle East, and East Africa before subsiding in 1824. The second pandemic from 1829 to 1851 traveled further, reaching Europe, the Americas, and the Pacific Islands. British physician John Snow mapped cholera cases in London during the 1854 outbreak, identifying the Broad Street pump as the contamination source and establishing epidemiological methodology. The third pandemic from 1852 to 1860 killed over 1 million people in Russia alone. These recurring waves killed tens of millions globally and continued into the 20th century, with the sixth pandemic from 1919 to 1923 claiming millions more across Asia and the Middle East. The 1918 influenza pandemic infected approximately 1/3 of the global population over 2 years. The H1N1 virus variant appeared in spring 1918, with initial waves relatively mild. Military movements during World War I facilitated rapid international spread as infected soldiers traveled between continents. The second wave in autumn 1918 proved extraordinarily lethal, striking young, healthy adults with particular severity. Victims developed bacterial pneumonia complications, with many drowning in fluid-filled lungs within 24 hours of symptom onset. The pandemic killed an estimated 50 to 100 million people worldwide, exceeding World War I combat deaths. India lost between 12 and 17 million people. Remote Pacific islands saw entire communities perish. In the United States, approximately 675,000 died, with cities implementing quarantines, closing schools and theaters, and requiring masks in public. The pandemic disrupted industrial production, overwhelmed medical systems, and created labor shortages that compounded post-war economic challenges. Tuberculosis killed more people during the 19th and early 20th centuries than any other disease. The bacterial infection, Mycobacterium tuberculosis, spread through respiratory droplets in crowded urban environments created by industrialization. In 1815, tuberculosis caused 1 in 4 deaths in England. The disease killed an estimated 1 billion people between 1850 and 1950. Sanatoriums were established across Europe and North America for treatment through fresh air and rest. Robert Koch identified the causative bacterium in 1882, and the BCG vaccine was developed in 1921, though effective antibiotic treatment only arrived with streptomycin in 1943. The disease persisted as a major killer through the mid-20th century, particularly affecting crowded tenements and industrial workers. HIV emerged in Central Africa during the early 20th century, crossing from chimpanzees to humans through bushmeat handling. The virus remained largely undetected until spreading globally in the 1970s. The first recognized cases appeared in 1981 among gay men in Los Angeles and New York who developed rare pneumonias and cancers. The human immunodeficiency virus attacks the immune system, allowing opportunistic infections to kill patients. AIDS spread rapidly through sexual contact, contaminated blood transfusions, and needle sharing. By 1990, an estimated 300,000 people had died globally. Sub-Saharan Africa experienced the most severe impact, with prevalence rates exceeding 20% in some countries by the late 1990s. Combination antiretroviral therapy, introduced in 1996, transformed HIV from a death sentence to a manageable chronic condition in wealthy nations, but access remained limited in heavily affected regions. Between 1981 and 2020, approximately 36 million people died from AIDS-related illnesses.
Malaria has killed humans for thousands of years, with evidence of the parasite found in Egyptian mummies. The disease, transmitted through Anopheles mosquitoes, remained endemic across tropical and subtropical regions. During the construction of the Panama Canal from 1904 to 1914, malaria and yellow fever killed over 25,000 workers before mosquito control measures were implemented. Throughout the 20th century, malaria killed millions annually, particularly children under 5 in sub-Saharan Africa. Global eradication campaigns using DDT insecticide succeeded in eliminating the disease from North America, Europe, and parts of Asia by the 1970s, but resistance and environmental concerns limited further progress. Between 2000 and 2020, malaria killed approximately 12 million people despite widespread distribution of insecticide-treated bed nets and artemisinin-based treatments. Measles killed millions of children annually before vaccine development in 1963. The highly contagious virus spreads through respiratory droplets and causes complications including pneumonia and encephalitis. In the pre-vaccine era, measles infected nearly every child by age 15 and killed an estimated 2.6 million people annually worldwide. Island populations with no prior exposure experienced particularly severe outbreaks, with the 1875 Fiji epidemic killing approximately 40,000 people, roughly one-third of the population. Vaccination campaigns reduced global measles deaths by 73% between 2000 and 2018, preventing an estimated 23 million deaths, though the disease continues to kill over 100,000 people annually, primarily unvaccinated children in low-income countries. Typhus, spread through body lice, thrived in conditions of war, poverty, and overcrowding throughout history. The disease caused by Rickettsia bacteria killed millions during military campaigns and famines. Napoleon's retreat from Moscow in 1812 saw typhus kill more French soldiers than combat, with an estimated 220,000 deaths. During World War I, typhus killed 3 to 5 million people in Russia and Eastern Europe amid the chaos of revolution and civil war. The disease continued to devastate concentration camp populations during World War II until DDT delousing became standard practice. Across centuries, epidemic typhus killed tens of millions during periods of social disruption and displacement. These diseases transformed human societies through demographic collapse, economic disruption, and political instability. They drove medical innovation, public health infrastructure development, and international cooperation. The patterns of emergence, spread, and control continue to shape global health priorities and responses to infectious disease threats.